welcome to another fun episode of Thrive Live. Today we have Dr. Kevin Smith, a specialist in thyroid. Dr. Smith is a board-certified chiropractic physician, author, and speaker. He did his pre-medical training in Pittsburgh and graduated from Duquesne University in 1993. Following this, Dr. Smith went on to study at the Palmer College of Chiropractic, where he earned his doctorate degree in 2001. He has extensive postdoctoral training in regenerative medicine, neurology, blood chemistry analysis, and the latest physical medicine technologies, including non-surgical spinal decompression and cold laser therapy. He's a board certified in chiropractic, clinical nutrition, integrative medicine, and functional medicine. He's also the author of the book, Modern Chiropractic, The Way to a Pain-Free Lifestyle. So today we are very excited to have Dr. Smith on our on Thrive Live, and we're going to get into a fun discussion on the thyroid.
Well, thank you, Dr. Abercrombie. Thank you for having me. I hope that I do a good job, and I hope that your listeners learn something.
I'm sure they will, based upon the talking points that you sent over. So let's get into it. What are some of the, why is thyroid disease a thing? What are some of the statistics that we see within our population?
Okay, well, thyroid problems are one of the most common endocrine problems that people suffer with. There's about 25 million people per year that have thyroid disease. It's about 8 times more women than men. About 60% of the people that have thyroid problems are not even diagnosed, so they don't even realize that they have it. And more than 12% of the population are going to develop some kind of a thyroid problem at one course during their lifetime.
Pretty common. I mean, I can tell you also in my medical practice, super common, but
yeah, right.
Yeah. Yep. Yeah. And unfortunately, so much is just walking around undiagnosed, and we're only looking at the medication piece, but we'll get into that. So what are some of the signs and symptoms that we should be looking out for with thyroid?
Okay, so people that have thyroid problems have a pretty predictable kaleidoscope of symptoms and health challenges that they deal with on a daily basis. And again, they might not even realize that it's linked to thyroid dysfunction. They may not even understand what's going on with them, and they're not getting answers from their doctors. But some of the common symptoms are things like weight gain, or the inability to lose weight, even with diet and exercise. Things like low energy, brain fog, decreased mental awareness, or decreased mental clarity, gastrointestinal problems such as constipation or diarrhea, or intermittent oscillating between the two of those. Sleep problems such as insomnia, or problems either falling asleep or staying asleep throughout the night. They may have some mental issues, either anxiety, nervousness, depression, anxiety. They could have decreased libido. Their hair could be falling out in chunks, or they could have dry, brittle hair, or the loss of the outer 1/3 of the eyebrow. They could have heart palpitations. They could have new food intolerances, things that they could have been eating all their life, and all of a sudden, out of the clear blue sky, they have a problem with tolerating certain things. Chemical sensitivities, infertility or menstrual problems, and weak or cracked fingernail beds. And you don't have to have all of those issues. You can have one, or you can have more than one, and we can link that back to a thyroid issue.
Yep. And just also to kind of help our listeners understand why all those symptoms are all linked together, the thyroid kind of governs these systems.
Right. Every cell in your body has a receptor site for a thyroid hormone, every single one. And so the thyroid hormone is kind of like the accelerator pedal in a car. If you press on the gas pedal, the car speeds up. And if you take your foot off the gas, either it slows down or it stops. So if you have a certain cell in your body that is not getting a sufficient amount of thyroid hormone, and you have hypothyroidism, that could affect that particular cell's function. So for example, if you have a neuron in the brain and the neurons are not getting sufficient amount of thyroid hormone, that could lead to brain fog or depression or anxiety or nervousness. If you have a cell in your gut that's not working right because you have hypothyroidism, you can have the inability to move bowel along the transit times, and you could have constipation, or you could have the opposite of that, which is diarrhea. If it affects the heart cells, that can cause things like heart palpitations. So all the different connective tissues in the body ultimately rely on some kind of thyroid function to work correctly.
And then, so kind of to take it to the next evolution of our thought process here, since especially as we see is how the thyroid is integrated, integral to all these different systems in the body.
Yeah.
Well, let's also take a moment to talk about, well, what's the root to the thyroid?
What's the root cause of thyroid dysfunction?
The root cause to why the thyroid dysfunction happens, and
Okay.
This can kind of segue into the discussion of medication and
Right. Okay, so the only way that you can really determine accurately if the thyroid is working correctly is through a blood test. And the blood test that they typically will do is called a TSH, or a thyroid stimulating hormone test. And there's a certain reference interval for the thyroid where there's a low number and a high number. And if you're between those two numbers, you're considered to be normal. But if you go above that high level, then you have hypothyroidism. I know it's kind of paradoxical because you think low numbers would be hypo, but in this case, a high TSH or above 3.0 indicates hypothyroidism. 90% of all the time that people have hypothyroidism, the American Academy of Endocrinology has determined that it's due to an autoimmune disease called Hashimoto's autoimmune thyroiditis. And it was discovered in the 1920s or 1930s by Dr. Hashimoto, oddly enough. And with an autoimmune disease is your immune system, your white blood cells are supposed to be protecting you against a viral infection or a bacterial threat or a parasite or something like that. It's supposed to wander around your bloodstream and look for invaders and destroy those. And when the immune system, when the white blood cells attack and destroy your own body tissue, that is what's known as an autoimmune disease. And autoimmune disease has certain predictable areas that it likes to pick on, like the thyroid gland, the skin, the gut, the brain, things like that. And with Hashimoto's disease, those white blood cells are attacking and destroying the thyroid follicles, destroying the thyroid gland. That's 90% of everybody that has low thyroid function. And so Hashimoto's is not an endocrine problem, it's an immune system problem. And so if you go to see an endocrinologist, they're not going to appreciate strongly enough, in my opinion, the immune system component, which could be the underlying cause of this. So maybe you want to ask yourself, well, what causes that to happen? Nobody really knows exactly what triggers an autoimmune dysfunction in the body. A lot of researchers have thought that it could be coming from some kind of a major life issue, like the birth of a child, or a surgery, or a trauma, or a massive viral infection, or something like that. And so there's two parts of the immune system. There's the Th1 part and the Th2 part. And the Th1 part is the immediate response division of the immune system. So when you get an infection, the Th1 activates and they swarm in. The Th1 is kind of like the Marine Corps. They just kill everybody. And then the Th2 division is the memory part of your immune system. That's the part that remembers every time that you've ever had an infection and what the presenting bug looked like. So that in the future, if you ever have that exposed to that bug again, your immune system is supposed to give you naturally acquired immunity for the rest of your life. What's going on with autoimmune disease is that the Th1 and Th2 divisions are no longer in balance. One of them becomes dominant and the other one becomes recessive. And so we have to identify which one of those immune system components is the dominant part, which one's the recessive part, so that we can get a handle on the immune system issue. And so once we've identified if it's an immune system problem, and once we've identified where the component could be coming from, then we have to look for things, what I call are triggers. And triggers are peripheral problems that can cause your thyroid gland to dysfunction. And there's about 9 of them. There are things like anemia, blood sugar problems, problems with cortisol or adrenal problems, sex hormone imbalances such as estrogen dominance or progesterone problems. It could be coming from things like chronic inflammation, or it could be coming from gastrointestinal problems such as leaky gut syndrome or dysbiosis, or some kind of an autoimmune cascade on the gut. It could be coming from food intolerances or food sensitivities that can throw off your immune system function. It could be coming from chemical sensitivities or chemical exposures. A lot of times people that are exposed to things like, say, plasticizers or household cleaners, that can be an endocrine disruptor, and that can cause problems with your thyroid gland. And it can also be caused by stealth infections or infections that have never been diagnosed or never resolved properly, such as a Lyme's disease infection. And so we need to identify what the triggers are in order to be able to identify all the different peripheral components that could be causing your thyroid gland to dysfunction. And the way that we identify these triggers is through the use of testing. And we do a variety of different testing, such as blood testing, urine, stool, or saliva. And so we take samples and we send it to a laboratory. We take an objective measurement and find out, are you where you should be, or are you out of balance with that? And if that's the case, then we will do things to try to bring that part back into balance so that you can get your thyroid gland back in control. The thing is, it's rarely ever the thyroid gland itself. It's usually some kind of a peripheral component that's causing these problems. And so by doing the lab testing and identifying where the root causes of coming up with this, we're able to bring that back into balance and help the people with all these different dysfunctions.
Yeah, it's so important to, when we want to, truly heal the thyroid, is to look at that periphery and see what kicked it off. And just more as a colleague to colleague question, what are the more common stealth infections that you see? Because I know I definitely see the EBV, the mold, toxicity, Lyme. What are kind of the top ones that you're seeing in your practice?
Basically the same thing. The stuff that typically is either unresolved, it's misdiagnosed, or it's completely missed by the medical doctors, because they'll run like predictable panels. They'll run like a CBC and a differential, and they may miss a some kind of a mold toxicity, black mold or something like that. Or it can be coming from, not even that, it can be coming from a yeast infection. So if they have an overgrowth of abnormal or pathogenic bacteria growing in their gut lining, that can cause a yeast infection, and that can cause your thyroid to fall out of kilter.
Yep. Cool. And then just another kind of more colleague to colleague question. So I remember, when I was in medical school and we were talking about Hashimoto's and thyroiditis and the autoimmune activation, I feel like at that point, it was really more of a discussion of Th1 driven versus Th2. And for our listeners, that goes back to like the Marines are coming in with Th1 versus the antibody, or more, not the antibody, but the Th2, which I refer oftentimes within my patient population as like your local police guy who's monitoring the situation. Yeah. And then now I feel like recently we're seeing more pop up about Th3, and Th3 has always kind of been more of that balancing piece. But I feel like I've recently been seeing that now we're seeing some thyroid or some autoimmune processes more Th3 driven. And I haven't done too much into the research on that yet, but
yeah,
have you started to see that?
You can get pretty deep into it. Like there's the Th17, which is the inflammatory markers and stuff like that. But most of the time, I'm mostly looking at the Th1 and Th2 balance. And so in order to identify where the imbalance may be occurring, I will give the patient a herbal botanical provoking agent. And one of them would be to like upregulate the Th1 division. And so, and I'll have them keep a little diary. So they'll take the Th1 supplements for about 3 days and to write down, are they better? Are they the same? Has it gotten worse? And then we switch days 4, 5, and 6 to the Th2 supplements. And I will do the same thing. I'll have them write down, is it the same? Is it better? Is it worse? That kind of stuff. So let's say, for example, I give them a supplement that is mostly TH2 driven. And when they take that supplement, they tell me that they got a lot worse. Well, that tells me that they're TH2 dominant because I'm pushing them over the edge and kind of provoking a response. It's not a really harsh response, but they will tell me, they feel more tired, or they're not sleeping as well, or any of the different symptoms that they initially started with seem to get worse.
Yep. Yeah, I've used that technique before too. It's a quick and easy way to get your answer.
Yeah.
Yeah.
Yeah. Unfortunately, there's no laboratory test that I'm aware of that can let me know just with a blood test if they're TH1 or TH2 dominant. Usually I have to do like a provocation test to find that out.
I've attempted a couple times for my fertility cases where we think there's an autoimmune subclinically that's kicking it out, running the cytokine and natural killer cell panels. But still, even with that, I feel like I'm extrapolating. So I think almost the herbal trials are better just to provoke, see, hey, does it flare you? We know it's this one.
I'm sorry, I had a hard time hearing you. Could you repeat that?
Oh, yeah. No, I was just saying that, I've even attempted running through blood work, the natural killer cell cytokine profiling to see if we can identify more for the fertility cases.
I gotcha. Okay.
But at the end of the day, I think that clinically provoking, we get the better answers.
Yeah.
It's more obvious. Yeah.
Yeah. I think that one of the key components to correctly identifying the nature, the root cause of this problem is by doing a proper workup and doing a comprehensive enough array of testing. And that's one of the things that I feel that the medical doctors don't do enough. They rely only on the TSH and T4 loop that they get in a standard blood panel, and then they'll give you your levothyroxine or Synthroid, and that's it. And unfortunately, that only helps with about 17% of all the cases that are out there. The other 83% of the people that have thyroid problems are not going to be able to get corrected. It's not going to touch their problems because it's not addressing the root cause of this issues. The medical doctors don't order a sufficient amount of tests, and they also don't use the correct framework to try to interpret the lab tests. They want to base the analysis based on a sick patient population, and I base my values on a healthy patient population. I think that if you had a medical problem, you would want to compare yourself to a healthy patient population rather than a sick patient population. And so a lot of times, the reason that medical doctors don't order enough tests and they don't read the tests correctly, that's just part of their training. It's part of their residency, and it's part of what they took into practice when they went into practice. It's not because they're bad people or anything. It's just it's a broken model. And the current system of what we do in primary, what they do in primary care, that's dating back to the 1960s. And while the names have changed over the years, the methodology really hasn't changed a whole lot.
Yeah, I would agree with all that.
Yeah.
Yeah. And, there's 100% time and place for the medication, but it's like throwing a blanket over a blinking sign that's saying, hey, you got to look internally. There's other stuff that kick this off. Go search for it. Exactly.
So like if a patient actually needs thyroid medication, if they legitimately need thyroid medication, then they need thyroid medication. There's no question about it. In my practice, I work with the medical team. I'm not a replacement for your medical doctor. I'm an adding to, just kind of like how a dentist is not a replacement for your primary care physician. So I specialize in a very narrow area, which is autoimmune hypothyroidism. And so for people that are having these types of problems, I think that a lot of times they want to look beyond what they can get just from their family physician. It may be a trusted member of a friend of the family. It's been with them for a lot of years. But when it comes to certain problems, such as thyroid problems, they're not really doing a sufficient job at managing these problems. So Sometimes there's a time and a place for medications, and sometimes you have to look a little bit beyond that.
Yeah. Yeah, you have to, I'm always trying to get patients to think about, what's the purpose behind taking this? Whether it's a supplement or a medication, like, is it getting us to that finish line where we want to be and getting down to the root cause layer? And sometimes we need more of that palliative aspect. And, but I think that's kind of the beauty and the fun of medicine is
Right, exactly.
that.
It's that's why they call it practice.
Yes, it is practice. Yep. So what are some, let's talk about maybe some of the key nutritional foundations for the thyroid.
Okay, so in order to identify what the patient actually needs, first we have to identify where they're deficient or where they're having some problems. There's no one size fits all approach that's going to accurately give everybody what they need, because one person may have specific needs and another patient may have a completely separate problem and different triggers or different things that they need. So the first thing that we have to do is some lab testing. And I allow the lab testing to identify where we have to take them as far as supplementation and diet, because there's no one size fits all to this.
I agree. It's a combination of our environment, our genetics, our gut, all those root cause layers that we've just discussed. How are they all interacting with each other in this greater orchestra of the thyroid?
Yeah, exactly.
Yeah. Awesome. So let's talk about kind of expectations of treating the thyroid in that process, because I think so often we're used to in medicine, take this pill, you're going to feel better.
Right. So in medicine, that's what they do. They give you a chemical to push your blood chemistry or your body chemistry into a certain area. My job is not to fight the body. It is to identify where you may be having some problems and then try to address the root cause of the symptoms rather than masking the symptoms themselves. So I'll give you an example. If a person has digestive problems, then the typical medical approach is to give them a proton pump inhibitor like Prilosec or something like that, or give them an antacid or something like that to try to help them to reduce their indigestion. They don't really ask the question, why are they having this problem? What are the different factors that could be going into the driving forces that are affecting their indigestion? And are there any other problems that could be related to this? So for example, do they have a hiatal hernia? Do they have a problem with malabsorption? Are they having problems with occult blood or bleeding inside their body? Are they having a problem with dysbiosis, which is a ratio of bad bacteria to good bacteria? That's why people take probiotics. Are there any other types of problems? So we'll do, say, like a GI map test and map out their ecology of their gut and look for any kind of hidden root problems with that. And that will guide us to what kind of program of care that they're going to need. So this is actually a very customized approach to care. It's not like a one size fits all. Everybody takes this pill and get out of my office and see in 6 months. And that's typically what you see in primary care. Most doctors that I'm aware of, they work with about 12 drugs. And if what the person has doesn't fit those 12 drugs, then they refer them to their buddy down the street that has another 12 drugs and such and so forth. I'm not anti-drug. I believe that drugs can save a life, but I believe that we as a people are over medicated. And when I talk to people, they say that they would really rather not take all those pills if they don't have to, and that they are not aware of any other types of choices that are available to them. And so what I say to them is, just like there's more than one way to cook an egg, there's more than one way to fix a health problem. The drugs are one approach, but it's not the only available option to you. You have a lot of other choices, including lifestyle modification, nutritional supplementation, chiropractic, acupuncture, massage therapy, exercise therapy. It just goes on and on and on. But most of the time, the medical doctors are so embroiled in what they do that they're not really looking at all the different options that could be in the best interest of their patients.
Yeah. So since we have a couple of people on live right now, let's open it up to Q&A. If you have any questions, just pop them in the chat while Dr. Smith and I kind of keep going. Yeah, and I also tend to see kind of reshaping that expectation when patients come to see practitioners like us, where it takes longer to treat that root cause layer.
Yeah, I mean, it's not usually it's not an instant gratification. It's not a quick fix. As Americans or people living in the United States, we want things done just like that, and we don't want to pay for it, and we want a mail order, right? And so,
oh yeah,
a lot of times the problems, it took time to get to where they are now, and naturally, it's going to take some time to unwind their problems. And so I tell them to just be patient. I would think to make a major metabolic shift in the body, it takes about 3 to 6 months. And so the first thing we do is we look at their medical history, we give them some questionnaires to fill out, and then we ask them what their goals are. What are you trying to achieve? What are you trying to accomplish with your care plan? And then we design a program of care based on their goals, their clinical presentation, and what showed up on their lab studies. And from there, we can kind of monitor them, coach them along, and kind of monitor the progress, track the results, and see what's going on over a period of time with them.
Yeah, there's so much value in doing that investigative work. I know it can be expensive up front per se on the labs, because insurance is not going to want to cover all these nice functional lab tests that we want to run, but it saves so much time and money down the road by being able to get those answers now.
Right. Yeah. I mean, the mechanic told me either you pay me now or you pay me later. And you know what happens when you have to pay them later. So better to fix this problem early on rather than allow it to manifest and get completely out of control. And at which point it may be that there's nothing I can do. So
yeah. Yep. And on that point, we should also just not just looking at those who already have thyroid disease manifested, but our teens, right? Our kids.
Right.
Yeah. Getting on that early. So, well, fantastic. Let's see.
We had a question come in.
We do. Can you read it?
Yeah. Stella had asked a question, what are your suggestions in treating Graves' disease naturally to the point where it can stay stabilized or be in remission, diet, exercise, and medication? So, okay, so when it comes to thyroid problems, about 97% of the time it's hypothyroidism, meaning it's decreased thyroid function. Graves' disease is typically an autoimmune disease where the thyroid is too high. It's spinning out of control, and a lot of times that needs to be managed by an endocrinologist so that the patient's not at risk of a thyroid storm. But there are a lot of different natural things that I would look at, such as making sure that the immune system is not out of control first, because Graves' disease is an autoimmune problem, and it can cause a lot of problems. And I would take it in the exact same direction. I would look at all the different types of triggers, and there's no one particular lab test that you would run for Graves' disease. I would think that you would want to take a comprehensive look at all the different factors and components and symptoms, and just go down that rabbit hole and get properly tested and just continue to evaluate it. I've had a couple, more than a couple Graves cases, and we were able to help them to regulate that and to push their thyroid gland back into normalcy.
Yep. Yeah, and that's a good point from the aspect On the pharmaceutical level, we'll have different pharmaceuticals for Graves versus Hashimoto's, right? The hyper versus the hypo. But on the root cause level, we're going to be going down the same rabbit hole of what is that person's root cause triggers? Is it the stealth infections, the chemical toxicity, everything that you just very well covered? Yes.
Yeah, and I think that a very common approach, that medical approach to treating Graves, is to remove the thyroid gland itself, either surgically or with nuclear medicine, to eradicate the gland. I think that surgery sometimes is necessary, but I would think that you would want to do everything you can before you approach that, before you allow somebody to remove your thyroid gland. You want to see what you can accomplish through natural means, through something that's less invasive, that's more gentle, and it's not going to be permanent.
Definitely. Because once you take it out, you can't put it back in.
No, it's a one-way street.
Yeah, one-way street on that one.
Yeah.
That was a great question. Opened up to a lot of discussion like that. All right, perfect. Well, and to honor everyone's time, we'll look at ending it. Thank you so much for coming on. You added a lot of value, and I love just the discussion points that you brought up. So thank you very much. We appreciate you.
Well, thank you for having me, Dr. Abercrombie. I appreciate being here, and I hope that if anybody has any questions, they just feel free to drop me a line.
Perfect. And I will have all your information. And for the listeners, I'll have Dr. Smith's information at the end screen. You can also find him at integratedthyroid.com. So
thank you very much for having me.
Thank you so much. Have a wonderful weekend.
Thank you.
Bye.